It is my absolute pleasure to welcome again, like last week, 2 weeks ago, excuse me, Liz Brooks. Liz is a private practice international board certified lactation consultant, aka IBCLC, and licensed lawyer. She works bedside at 2 breastfeeding friendly designated hospitals. Currently, home visits are on COVID hold, and teaches and lectures worldwide on legal and ethical issues for lactation support providers. Lactation helpers like IBCLCs struggle with ethical, legal, and moral concerns in their everyday work settings. With plain language and humor, as we saw 2 weeks ago, Liz shares tips for immediate use to protect both the family and the clinician. She authored the only textbook on legal and ethical issues for the IBCLC and writes extensively for other textbooks, blogs, and peer-reviewed journals. Liz uses wit and wisdom to share pragmatic suggestions for anyone who supports lactating and human milk-using families. Liz self-identifies as a cisgender, hetero white woman with unearned privilege, and I appreciate that every time I hear it. The whole thing uses she, her, hers pronouns and advocates for inclusive care and language. Liz, it's a pleasure to welcome you again. Thank you.
Oh, thank you, Miss Susan. And I absolutely love your costume. I was chortling right out loud when you stood up. Good thing my
We knew you
on.
would.
Yeah. So I am now going to share my screen, and with any luck, you guys are going to be able to see this slideshow. Come on, from current slide. There we go. So if anybody is having problems, somebody is going to magically tell my ears that we're having problems. I'm thrilled to be back with the Kansas Breastfeeding Coalition. You guys did such a great job 2 weeks ago. I just have to assume that today will be just as spectacular. Well, we're going to just kind of learn everything that you need to know about ethics, just everything, in an hour, and hopefully we'll do it without me sounding like that recorded voice at the end of a car commercial where they speed things up so they can quickly get in all the stuff that the laws and regulations say you have to do it. But what we're going to look at is the intersection between the International Code of Marketing of Breast Milk Substitutes, racism-based health disparities, and lactation support, whether it's coming from a breastfeeding medical doctor specialist to a unpaid volunteer who's running a parent meeting every now and again. So that's a big chunk for us to bite off and chew, but let's see if we're going to do it. As always, I feel like I'm kind of repeating what just happened, but I kind of am not. I do always open any teaching session I offer with a land acknowledgement, but it's for the place where I happen to be sitting, which is the suburban area of Philadelphia. I would like to acknowledge that my presentation at this meeting is being held on the ancestral lands of the Lenape, the traditional caretakers of this land. I pay my respect to elders, past and present. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. I contribute to this effort to acknowledge what has been buried by honoring the truth. Please join me in a moment to consider the legacies of violence, displacement, migration, and settlement that bring us together today. I will again remind you to stop using your computer or your phone to record this session, because I have given permission to Kansas Breastfeeding Coalition to record it, and it will be made available to you for 3 months after today. Woohoo! So here's my disclosure. It's all wordy, wordy, wordy. And Miss Susan did indicate some of these areas of expertise, and I think it's relevant for you as the learners and listeners to know that if I'm going to be teaching you about law and ethics, that I do have training background and specialization in those fields. For this particular talk, I want to really super duper emphasize that my appearance is not funded by any commercial interest. You'd be shocked. No, you won't be, because you'll see some slides. But it is not uncommon practice for the teaching that healthcare providers get to be funded by commercial interests, to be scripted by commercial interests. It is really a quite pervasive way in which teaching happens. I will be showing examples of things that are that violate the international code and the spirit of the international code and violate conflict of interest requirements for those of us who are licensed and certified healthcare providers. But again, I do not endorse any of those people or things, and they have not endorsed me by paying for me to be here. All of y'all have paid for me to be here with your conference seminar fees. I thank you all for signing up to be at this conference, and I, of course, thank KBC for inviting me. And I do like to just show this as a way to remind us, because it's not all about me, even though this slide is all about me, but these are the different things I do in lactation land. They all come together under an umbrella. That's what I look like. And you might make assumptions on who I am and what my biases might be based upon my appearance. And you might be right about many of them, maybe even all of them. Here's how I self-identify. And the reason I think it's important for us to be reminded, when we're learning and teaching is, look, I can be super hyper vigilant, conscious aware that my lived experience is different from other people. And I can really, really try to use language and to analyze situations and to discuss and teach them in a way that is inclusive in language and inclusive in intent. But I got nearly 65 years of learning who I am that I have to claw through before I can get to the other side where the sunshine is, right? We all need to embrace that we all have biases, and we usually use that term in a negative way. I have a great deal of bias for dark chocolate, and I'm so thrilled that it's Halloween weekend because I will be able to richly work on my biasing. We should all kind of know who we're listening to and where they're coming from. And this is the way I self-identify. Look, there might be bits and pieces of me that I don't even know were there. And people might have that opinion of me, and that's okay. You're entitled to have your opinion. But, I might be sitting here feeling very smug that, I'm not a bossy pants. And there might be somebody watching this saying, she is such a bossy pants. And that is clearly coloring the way in which she is sharing her information today. With any luck, we're going to meet these objectives. Again, I don't know if we're going to do it. You got to figure it out, put it on your evaluations at the end of the session or the end of the conference. I do want to remind you to walk away from the words as we zoom through some of these slides. There will be slides that have a lot of wordies on them, and it's not there for you to have to copy down. It's there for you to see the source for the claim that I am making, right? I'm giving you the citation, so to speak. And again, if you do feel compelled to write it down word for word, you just get the recording and you can watch it at your leisure. Those of you who might want to learn a little bit more about doing a land acknowledgement, which anyone can do before a public meeting or an educational session, I encourage you to go to USDAC and see the wonderful materials and the photographs and the slides which they share. They want you to use them and to use the language. And I encourage you all to start doing that at the starts of your meetings. So let's just do a quick little zippity-doo-dah overview of what we're going to get crammed in this next hour, right? I'm willing to bet that everybody sitting on this webinar, if you've done any kind of work in lactation land, have had an opportunity, to discuss the use of formula, the use of bottles, and the use of teats, right? I mean, doesn't that make sense? Especially those of us that are clinicians, because we are working with people that are having problems. And if you're having problems, sometimes what we're needing to do is supplement the baby to make sure the baby's doing okay. And sometimes we're having to offer extra stuff to the baby, whether it's express breast milk or formula or something else, maybe pasteurized donor human milk from a human milk bank. So we talk about things that are covered by the code all day, every day, all day, every day. And for some reason, lactation land just has this thing up where they just can't, they just want to, grit their teeth and just, turn and run when they hear the words International Code of Marketing Breast Milk Substitutes. I'm telling you, it's not that complicated. I am telling you, it's going to be super duper easy peasy for you to respect its tenets. And I'm going to also remind you that it's nothing more than a subset of conflict of interest analysis. And most of us know that conflicts of interest are a bad thing. We might not be able to define it super easy. Don't worry, I'll give you some easy definitions. But if you can kind of get your head away from the words international code and just kind of put your head space into conflict of interest, suddenly I think it will seem a lot less, I don't know, scary. Maybe that's the way to put it. Scary, for some things that it'll be easier for us to understand the concepts. Because look, here's the deal. In lactation land and lactation support, we often say we take our families as we find them, right? Not every single person that we meet bedside or that we meet at the community public health center or at the parent-to-parent support meeting is going to or has been able to exclusively breastfeed at breast a baby for 6 months. And yet this is the international and national recommendation for all babies everywhere. All babies everywhere are supposed to be getting human milk for the first 6 months of life. And it often doesn't happen for various reasons. And sometimes it doesn't happen because parents don't want to do it for various reasons. And if we are doing our jobs well as lactation support providers, we are meeting our families where we find them. It's not for me to come in and say to this, newly lactating parent, oh, what do you need? You're not going to exclusively breastfeed. You've got to exclusively breastfeed. All of the documents say to do it. Here, you just sit right down because I'm going to show you what. No, that's not what we do. I should be saving that kind of language for when I'm going to the state legislature or the city council or the breastfeeding coalition meeting. And we're talking about broader policy initiatives that are the goal for everybody. That's very different from taking it down to one person and meeting them where they are and providing patient or client-centered care. Patient or client-centered care is always about the patient or client. Public health policies are always about the everybody's. Right? So we take our families where we find them. And we know that there are many situations where families are not directly feeding the baby at breast or chest. So they might be expressing some milk and putting it in the freezer. Look at this parent. Maybe this was not a birthing parent. This parent is giving this baby something. I don't even know what's in the bottle. I kind of like the fact that the parent and the baby have are engaged in beautiful eye contact. I don't even know if this is the parent. I think we could make an assumption. I don't know about you, but those of you with an expert practiced eye, I think there's express breast milk in that bottle. Some parents are needing to use infant formula. Sometimes I work in 2 hospitals and we're working with this piece of equipment all day, every day. Then this mom looked like she's just loving it. Like, oh, I can't wait to sit down with 2 pieces of plastic stuck on my chest, right? But I will also say too, look at that great colostrum she seems to be pumping out. There are lots of reasons we are going to use devices to help us move the milk, and prematurity is not the least of them. Look at this kiddo. Under the lights as per the evidence-based hospital policy. But is that baby skin to skin? No, because that baby's under the lights. Is that baby to feed at breast whenever the baby wants to? No, because the baby's under the lights. So there's many times when we would have the parent and the baby be doing something different than what's happening, but that doesn't necessarily mean that what's happening is happening for kind of spurious reasons. That the tension of policies is something that those of us that work in hospitals deal with all the time. What about this patient? Are you going to go in? Are you going to go in and tell this parent that no, she cannot provide human milk for her baby because it can't come from her breast? No, you better not be, right? So we know that we're going to be talking to parents about things and equipment. We're going to talk to them about pumps. We're going to talk to them about bottles and teats. We're going to talk to them about, infant formula, whether it's ready-made or made from powder. And we're going to be talking to them about how to safely do all of that stuff. We're going to talk to them about when and how they can get milk from another source, not coming directly from the birthing parent. So are they going to get it from somebody that they know informally? Are they going to get it from somebody that they know quite well? Maybe a member of the family. Are they going to get it from a human milk banking, a nonprofit milk bank from the Human Milk Banking Association of North America, aka HIMBANA? Right? We need to know about this stuff. Whether you're an IBCLC, a peer counselor, somebody who works as a licensed healthcare provider who runs up against people that are lactating, we need to know about this stuff. And remember, we take our families where we find them. And so if we're going to be discussing the international code, which is about marketing, and the proper care and support of lactating families, which is what breastfeeding support is all about, we have to figure out how we could blend the two. And here's the deal. You can put it down to tweak versions. The international code, it is about the marketing. It's the marketing. It's not the use of these items, and it's not your effective evidence-based supportive care and teaching about the use of these items to families that need it or want it. The international code is about all of the people that are spending billions of dollars, billions with a B, every year in various marketing schemes that are designed to get parents and healthcare providers to subconsciously, remember that bias slide I talked about when I was starting out? Subconsciously favor the product over the act of breastfeeding, right? So the International Code of Marketing of Breast Milk Substitutes says that the manufacturers of infant formula, bottles, teats, and baby foods that are meant to be given when the baby has before 6 months, I'm just going to round it off. Those companies are not supposed to be marketing to healthcare providers, and they are not supposed to be marketing to families either. And here in the United States, really, what does that even mean? I mean, there's so much marketing that happens. We don't even know how much there is. People that come to the United States from countries that have enacted the code are sometimes a little gobsmacked to see all of the ads and things in grocery stores. It's really quite profound how much. So who is covered by the international code? Well, obviously healthcare providers are covered by the code, or health workers is the term they use. But really the code is a call. It's not even a mandate, because the World Health Organization isn't the government of the world, it's the World Health Organization. And they come up with recommendations that they ask governments of the world to do. So the WHO code is a recommendation that the nations of the world, go back to your countries, nations of the world, and pass a law, pass regulations that implement and support the elements of the international code that are about regulating predatory marketing, and give yourselves a way to enforce it. So governments of the world are supposed to follow it. The companies that make the products that fall under the code are supposed to follow it. Systems, hospital systems, healthcare systems, public health systems are supposed to follow the tenets of the code. Of course, healthcare providers, licensed, certified, whatever. If you're in a role where you are working with lactating families and children, you are intended to be following the code, whether you're a volunteer or whether or not you get a salary to do it. And anybody can, please, please, please choose to follow the code, even if it has not been legislated in your country. And it is not legislated in the United States. It is not legislated in any state of the United States. However, if you work for a baby-friendly facility and are seeking to be certified or seeking to be recertified as baby-friendly, you absolutely, positively must be following the code. It is part of what baby-friendly requires. So I like to say the code may be the law of your land inside your hospital where you work, even if down the road at the physician's office, the pediatrician's office, they are not respecting the code. Let's look at the bottom line of what conflict of interest is all about. And here's how that works. Look, commercial entities sell products for profit. That in and of itself is not a problem. There was a company that made this computer that I'm talking to you on, and I paid them a good chunk of money, and they made a little bit of profit on that. And I'm so glad that company exists, because now I can be talking to people in Kansas while I sit in the suburbs of Philadelphia. Making money by a company is not in and of itself a bad thing. And indeed, companies for-profit companies have a fiduciary duty, a long line of well-supported law that says not only can you make money, you better make money, because that's what the shareholders were expecting when they bought shares of your company. And if you're, goofing off and not making a ton of money, they can come and sue you for failing to meet the objectives to make money that your company rightly has. I can get on a soapbox about that, but I'm not gonna. But that is the law of the land in corporate law, right? What's the bottom line for those of us that work in healthcare? Healthcare providers sell good healthcare, right? Our goal isn't to sell a thing and make a buck. Our goal is to help our patients and clients receive care that is untainted by overt or inherent influence from commercial interests. So when we say to a family, you need to use a pump, it should be because the family needs to use a pump, and not because we got taken out to lunch last week by a pump manufacturer and now we feel a duty of reciprocity to do them a solid, right? You see the difference? We sell good healthcare. Companies sell things. They sell for profits. So here's our, classic corporate dude. What's his job? His job is to grow money, right? Make profits for the company. Here's a healthcare provider. What's her role? Her role is to provide good healthcare to this family. One thing I want you to be aware of is that parents only owe a duty of care, a fiduciary duty of care, to their own children. So parents can give each other horrible and fantastic advice over the proverbial picket fence. Parent influencers on social media can peddle whatever they want. But if you are an IBCLC, or if you are a WIC peer counselor, or if you are a doctor, or you're somebody that works at the public health office, you should not be peddling products, because you have a duty of care to the people in your sphere. So if you're a clinician bedside, you have a duty of care to those families that you're seeing. Parents do not have a duty of care to anybody other than their own children. And a lot of times in lactation land, people will get their knickers in a twist and they'll say, oh, that social influencer, she doesn't even know what she's talking. What do you mean lactation cookies? Everybody knows lactation cookies are a waste of money and they're terrible cookies to boot. How can they do that? We got to stop them from doing that. And I'm like, no, you're not going to stop them. And no, you can't. You don't have the authority. And please, there are so many better things that you could be spending your time and energy on. We do have to get the word out, though. Please, if you think you need cookies, talk to your grandma or your aunt or your sister, whoever makes your favorite kind of cookie, and tell them, oh, I need several dozen cookies because, it helps with lactation. All right, let's talk about the International Code. I keep talking about this thing. Let's talk about what it's all about. All right, so here we go. I'm just going to give you a quick, such a quick one through. I might even sing you a song, but maybe I won't. All right, so if you want to learn about what the International Code is, you're going to go to the International Baby Food Action Network website, and you're going to click on, what is the International Code, or you're going to click on the full code, and boom, there it's going to be. The International Code itself is not very long. And if you wanted to know which conflict of interest, which sections of it address the notion of we're against conflicts of interest, you would find them in these sections, right? In addition to the International Code, which was originally passed in 1981, 4 years before IBCLCs were even invented, I might add, there are also things called the World Health Assembly resolutions. And what happens is every 2 years, kind of the governing body, I call it the Student Council of the World Health Organization, comes together. And what they do is they review all of the World Health Organization's policies and recommendations in all areas in which they work. One of them, of course, being breastfeeding promotion and support of the International Code. And while you cannot change the underlying basic document, what you can do is allow for clarification or magnification of the language that it's already there. So you can't change the code, but you can sure as heck make sure that the code is being interpreted and implemented as it was originally intended to do. So if you're going to do your full research on the code, you also need to be reading all of these World Health Assembly resolutions. And that does look like a daunting task. I will tell you, just as an FYI, a lot of the resolutions, they start out with the same language, whereas therefore. What really matters with these World Health Assembly resolutions is all of the words that come after therefore. But just so that you know, I mean, a lot of people say, oh, well, the code was, passed in 1981. They didn't even have cell phones then. How could we follow that? Well, excuse me. No. Yes, it was originally passed in 1981, but every year after that, every other year after that, with the exception, I think, of one time, there have been clarifications and magnifications of what the code means. And they are the sections in which conflict of interest are discussed. This one that happened in 2016 was a big deal document in terms of no conflict of interest advocacy worldwide. So also back in the day, there used to be this fantastic organization known as International Code Documentation Center, and they were tasked with helping governments to draft excellent legislative language to enact the code within their borders and to provide teaching materials for people. I went to an ICDC code conference, and they have these 4 beautiful code essentials documents. But then what happened was, like a lot of entities that rely on money to be run and kind of running on a shoestring anyway, ICDC lost its funding. And so they have closed down. And the people that are now in charge of enforcing the code is the International Baby Food Action Network, which was actually the original organization from whence advocacy sprung so that the code was enacted. There are wonderful materials available on the World Health Organization to tell us about the status of the code and its enactment. And the latest one, it was done in 2020. All this is free for you. You can download it, PDFs, hundreds of pages. It can be sitting there on your computer. Here's what the most recent one looks like. And what they do is they break out for you, for every country, when they passed a code related regulation or law, and kind of, where things are. And here's just an example. I just picked Ireland. Apparently in 2013 and 2016, they passed some legislation, and they didn't cover all elements of the code, but they, covered some of them. And you can see some other countries, like there's no legal measures have been passed in Grenada or Guyana or Haiti. Looks like down here, Jamaica and Japan, no legal measures. No legal measures here in the United States. As I said, the International Code has not been passed as law here in the United States, nor has it been passed in any state here in the United States, although individual entities, baby-friendly hospitals, may be required to follow the code, and any one of us as individuals can put it upon ourselves to pledge to follow the code. But just to show you how these reports are, they beautifully drill down even further. So you remember, we were looking at Ireland that had passed some laws, and then we know that here are some of the areas in which they passed laws and regulations, having to do with the scope of the code. Apparently they didn't do anything on monitoring, but they had a whole bunch of stuff on promoting to the general public and nothing about promotion in healthcare centers. And you can see they drilled on even more. So let's see, for the scope, they had 8 things they did under scope. And then some of them were having to do with formula products. Some of them had to do with complementary foods. Some had to do with bottles and teats. So you can find out with great exactitude, here we go, what is happening in various countries in terms of what legislation they have passed. And so even though Ireland did a bunch of stuff dealing with the scope of the code, apparently it had nothing to do with complementary foods, had nothing to do with bottles and teats. They all of their legislative stuff was focused on infant formula being for the first year of life. So why do we care about this code again? Why does she keep harping on this thing? Well, I'll tell you why. Because it is a public health proclamation that affects every person on the earth, because it's meant to be a global public health initiative. The preamble, again, now remember, words, we're going to walk away from the words, but the preamble of the code talks about the reason we have it is because people deserve to attain and maintain good health. The code is meant to promote the good health of the mother, which is the language they used in 1981, and children, right? It also talks about the vulnerability of new families and how the usual marketing practices are unsuitable for these products. When you're home with a new baby, your life is focused on the baby, and it's very Darwinian. It's very survivalist. It's because this is your baby, right? You don't care if it's Sunday or Monday and the football game is on tonight. It's like, I got a baby here. The whole world revolves around this baby. And that very emotional decision making, and I don't mean that in a negative sense at all. I mean that emotions are driving decision making by new families, and marketers who are super duper expertly excellent at what they do know how to tap in to that vulnerable sensation that parents have. But the code says, look, we have a vulnerable group of people here. We cannot be throwing regular old run-of-the-mill, ads at them, because it's going to derail them from breastfeeding. And breastfeeding is what they need to do for a lifetime of good health for the baby and the parent, right? The code has been described as perhaps the most significant international consumer protection standard of all modern time. The Global Strategy for Infant and Young Child Feeding, another seminal document. It's tiny. You can get online, read it. It talks about we need to have breastfeeding protection, and we need to have no predatory marketing, because that allows for optimal health outcomes. And if you want to learn more about those optimal health outcomes, download yourself the Lancet's January 2016 series on breastfeeding. They're actually going to be updating it and adding it again in 2022. A phenomenal, beautifully assembled meta-analysis of all of the research, of all of the short and long-term impacts of lactation on the infant and the parent, the lactating parent, and the long-term outcomes. Beautiful piece of advocacy. Why? Because it's about global public health, right? And as Gail Christopher, the now, I think, retired, I can't remember if she was the chairman of the board or the CEO, or she was a leader at the Kellogg Foundation. It says, look, what a baby deserves when they come into the world cannot be compromised. Every baby on the face of the earth is entitled to the same kind of protection, support, and care. And the code is a very important way to do that. So we know that the code is about the public health, right? And public health is about everybody in the public. So who's in the public, right? Here we go. Traditional lactation language and advocacy materials assume a nuclear family that involves a self-identifying father, a self-identifying mother who got pregnant, probably the good old-fashioned wank, 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 and they produced a baby, and that baby is there with them, and that baby is coming to breast or chest to feed. That is the model upon which many of these documents are built. That's the assumption that these documents make. But here's my point, is that if breastfeeding, chest feeding, and human milk use are a public health imperative, and a public health imperative covers everybody on the earth, shouldn't we be including a family like this that self-identifies as two gay dads, right? Many gay fathers are not themselves lactating. No human milk for them? Like, what? Well, you didn't have a womb through which you birthed a baby that triggered this physiological thing called lactation? What, no public health for you? I don't think that's right. What about this beautiful lesbian, self-identifying lesbian couple who I like to say are meeting their baby for the first time along with everybody else in town, right? One or both of them may be lactating, one or both of them may not be lactating. No public health for them? This is an image of an adoptive parent, the one on the right, meeting her baby for the first time. I don't know how old the baby is. That head looks like it's not a brand newborn. If that's not an oxytocin glow on her face, I don't know what is. Are we going to tell this parent, oh, no public health for you? What about this single parent and this adorable baby? Aren't this family entitled to have optimal public health for a lifetime? Many families find themselves in a situation where the grandparent has custody and care of the child. Is this cutie pie on the left entitled to a lifetime of good public health or good health springing from the use of human milk? What about families with mobility issues? There is an awful lot of bias that goes on with people who have disability of one kind or another, and access to human milk is not the least of it. And once again, I'm going to ask you, you gonna walk in this woman's room and tell her she doesn't get to have a lifetime of good health for her kiddo and herself? Let's remember that global public health is about public health for everybody, right? So in a nutshell, the code is about the marketing and the no predatory marketing of formula, bottles, teats, and infant foods that are meant to replace breastfeeding at breast before 6 months of life. Now, these things in the upper right-hand corner, we're going to call these bottles and teats because they have a thing sitting on top of them. This lower left-hand corner, those of us in the United States tend to call that nipples. I'm going to encourage us to remember to call them teats, T-E-A-T-S. Why? Because that's what the code language says. And also the word nipple rather humanizes that object, doesn't it? And do you think that's a coincidence, right? So why do we care about the marketing of this? Well, here's an ad from 1908 in which an infant formula manufacturer is telling us that breastfeeding is best, but let me tell you, this thing I want to sell you has some valuable added extras, but don't you worry, it's easily digestible for the baby. And if you want a free sample, just right here. 1908, watch how these marketing messages have persisted for over a century. So here's an ad from 2012 for infant formula. Get your free sample, easily digestible, breastfeeding is best, and valuable added extras. 2013, free sample, easily digestible, valuable added extras. But the language now on breastfeeding is getting a little wishy-washy. I like to say breastfeeding is bestish. 2014, get your free sample, get your easily digestible, get your valuable added extras, and not a word about breastfeeding. The code requires the marketers of breast milk replacements to indicate, oh, by the way, breastfeeding is best, but if you can't, then, right? And in 2021, easily digestible, valuable added extras, and again, no language about breastfeeding. Here's, online. 1981, they hadn't invented, Al Gore hadn't invented the internet yet, right? So getting free samples is one of the most effective ways to hook somebody to favor you and your brand. And that's true for families, and it's true for those of us that provide care to families. One thing that's confusing, in part because the language of the code itself is a little bit kind of, wishy-washy on this, is that marketing and selling are two different things. Marketing is about creating a feeling for the product. It's touting a product's characteristics to create an emotional response. Like, do you think the manufacturers of this car have created this image because they want me to be thinking about this car weighs 3,000 pounds. It's got a horsepower in the engine of X. It's got 2C. No, they're trying to create an image, a feeling. Oh, we are all going to go racing around the, coastal freeways with our hair flying and our bright, shiny, gorgeous Porsche, right? Selling is just good old-fashioned boring selling and buying of stuff. It is okay to buy and sell stuff covered by the code. What you're not supposed to do is market it. And since most of us are not marketers and manufacturers of formula, bottles, and teats, you don't need to worry about that. What you need to worry about is you are not supposed to accept gifts and freebies from the manufacturers of infant bottles, teats, and baby foods intended to supplant breastfeeding at breast. You can always go and buy it. I hear all the time, oh, this code is ridiculous. I have families with preemies and they need to get formula and bottles and teats, and the code says you cannot do that. 100% flat out wrong. You get an F on the quiz. You absolutely positively can buy and sell these products. And you and I as healthcare providers and peer counselors can talk to parents about the safe acquisition and safe use of these products. But when we do the teaching, we are not supposed to be influenced by the commercial manufacturers, by having taken things from them that subtly influence us. Oh, can you tell? I just get hot under the collar on this. All right. So for example, here is a well-known retailer. This is a code respective manner in which to sell bottles and teats. it's just kind of boring. Like, here's 3 bottles. They've got teats. There's 3 of them. Let's see, there's gonna be 9 total pieces. They hold 9 ounces. They're dishwasher safe. You can get them all for, $3.50, right? It's just a description of the item, right? And you can do that. You look, you buy things. Can you imagine walking into a grocery store, going down the baby aisle, and everything's in a brown paper bag? Oh, there's something in here. You might want it, but you won't know it until you buy it, take it home, and open it up. No, consumers have a right to know what they're buying. They have a right to know what they're buying. They should not be unduly and inherently and subtly and unknowing to them be influenced to buy a product. How might that happen? Well, here we have the same big, retailer selling 2 bottles and teats for twice, 3 times the price. Why would this violate the international code? Because look at this language. This closer to nature bottle from this manufacturer is great for babies with colic. The advanced system is designed to eliminate the potential for excess air ingestion, so little ones with upset tummies can feel better after eating. Oh, I got a baby. I got to go back to work in 4 stinking weeks. My baby's going to have to be fed by the healthcare provider, or by the daycare person. I don't want my baby's little tummy to have excess air. Do you see how this is playing into the concerns that a new parent would have about their baby? Yeah, I do too, at 3 times the price. So here's the deal. If you want to 100% comply with the international code, here's all you need to know. And this is true for not only the code, but for conflict of interest in general. Don't take freebies or gifts of any kind. Do not take the mug. Do not take the pen. Do not take the lunch. Do not take the teaching. Do not take the mouse pad. Do not take the bag. Do not take the brownies that they deliver to the nurse's station during Nurses Week. Don't take any freebies or gifts of any kind. Just say no. And any IBCLC or breastfeeding helper or healthcare provider can talk to any parent about any product, even by brand name, in a one-on-one educational or clinical setting. And any person can buy and any person can sell any code covered product. That's it. This whole talk. Now, if you ignored my admonishment not to record this and you just took a snapshot of that slide, now you could go back to Candy Crush. But don't, because we have so many fun things to show you. Here's some more tweets. If you ever get a chance to read anything published by Anjali Palmquist, you're going to download it and you're going to read it. But as she indicates, she teaches the code as an ethics in marketing code grounded in human rights. Human rights. Keep that thought in your mind. It's not about infant feeding, although of course it's about infant feeding, but it's about protecting consumers from false advertising and unethical marketing, right? And we do this with cigarettes. We do this with liquor. We do this with pharmaceuticals, right? We know it's okay to limit commercial speech in some situations. So how does all of this play out in real life? Well, here's how it plays out in real life. I call this conflict of interest bingo. This is a wonderful article by Daniel Goldberg. Follow and read everything he has to say if you're at all into ethics and public health initiatives, right? So what are conflicts of interest? Everybody knows conflict is a bad thing. But I said, okay, fine. It's a bad thing. Define it. Most of us would probably look like this, like, oh, I don't know how to define it. So here's how I want you to think of a conflict of interest. It's a decision that you control that could earn you congratulations or income, right? Giving you the mnemonic of coin. Conflicts of interest are a coin. If I'm in charge of deciding who in the unit gets a raise, but we're told by the supervisors that only one person can get a raise, and I give myself the raise, can you see how that's a conflict of interest? It's a decision that I control, and it's literally giving me more income. So what's a professional conflict of interest? Well, a professional conflict of interest is when commercial influences are affecting your conduct in providing care. And here's the thing that is so insidious is you usually do not even know it is happening to you. You don't know it, but here's what happens when you take that free pen that has the pharmaceutical company logo on it. There's now a part of your brain that has switched on favorably to that company, and it's happening at a subconscious level. So like here, this was a lovely meme that somebody had created once. We're exclusively breastfeeding docs. So run by me again one more time why you're advertising infant formula to me and my mom. Right now, this actually was a setup picture, but it was based on something that had actually happened to a parent. So to review, public health is what? About everybody, about public health, safety, and welfare, right? It's coming up with pronouncements that are important for everybody. But what we recognize is that when we're doing individual care, we are always going to take individual risks versus benefits into account so that the parent can make an informed decision. So what we might be recommending for the public at large might be an entirely different kind of conversation than we're having with this one parent in this one situation in our one clinic seat that we're talking about with their stuff, right? So the reason we care about this, oh, I forgot to I'm going to quick show you this slide because now, yoo-hoo, we're going to get our ESERPs. These are the sections in the IBCLC practice guiding documents that talk about how one should avoid conflicts of interest. So there are some big deal reasons why lactation consultants care about this stuff. All right, so how does this play out in real life? Well, all this business that I keep talking about, like it's going to affect you whether you know it or not. I wrote a nice little editorial on it. So if you want to read, it's a free download, a full come on, there's a word that I'm trying to come up with. Open access article. Anybody can get a hold of it. All right. So this guy has been writing about the influence of persuasion, kind of marketing generally for gazillions of years. You can tell I literally was using this a lot when I was preparing various talks. But there's some elements of persuasion and influence that are universally known by all marketers and influencers and persuaders. Reciprocity is the notion if I gave you a gift, you owe me a gift. Yeah, you did me a solid, now I owe you a solid. Commitment and consistency means that we don't like to think that we have been doing things wrong. We like to stick and be consistent with a code of conduct or practice, because to change means that what we were doing in the past was wrong. And that's a hard thing for us as humans to kind of wrap our heads around. Social proof is about that person over there who's influential or that I like a lot is doing this thing. Other people are doing this thing, so this thing must be okay for me to do as well. Liking folds into it as well. Liking and social proof. You have to like and admire the people you see doing this thing in order to want to imitate it. Authority is when we see we as people, no matter where we are in the world, vest a lot of respect and value in our authority figures. And if our authority figures tell us to do something, we feel like, okay, they're our bosses, they're our leaders, they know, they have our best interests at heart. And if they're telling us to do something, we're gonna do it. Right. And scarcity, of course, is that concept of, oh, hurry up and buy it. If you don't buy it now, it's going to be gone forever. Right. So what are some examples? Well, here's an example of something I got in a couple of years ago, an email sent to me in my email. I don't know where they got my email, but of course my email is all over the place. So that in and of itself isn't alarming. It just means somebody took some time to cull some. So they're gonna, these are people that is research on gut microbiomes for babies. The research on doing gut microbiome is good. We should know that stuff. But when you now take that information that you've gotten from research and you're turning it into a product that you're selling, your goal has shifted now to your fiduciary responsibility to make money. So these guys were saying, come to this talk that we're giving, and oh, look, here's even a free sample, right? There was a lot of discussion back in the day with an entity that was a for-profit milk company. And what they were doing was if you're a for-profit milk bank, you got to get your milk somewhere, right? So they went into one of Detroit's Black neighborhoods and started to solicit the donation of milk. You could get $1 an ounce to this company without having done any kind of community building. It was the classic Columbusing. I'm going to come in and utilize this resource, and I'm going to decimate what's left as I hightail it with some money. And Kimberly Seals Allers, definitely Google this stuff up. She had some thoughts on that. Thank you very much. All right, here's another company a for-profit milk company. And look, oh, look, they're going to not only have a tour, but they, want to reassure me that if I, come to their tour when I happen to be traveling to their facilities, you will, don't worry about it. The money that we spend to have you come to tour our facility is not covered by the Sunshine Law at the federal Sunshine Law, where you have to report expenditures to market to healthcare providers, right? And they're just more than happy to tell us that their lawyers, they ran it by their lawyers. Like, you run it by your lawyer too, but let me just tell you, if you come, no one's gonna know, but we're gonna pay for it. This is the one that makes me still shake my head. It's November 2017. Look quickly, any of you that work in lactation, look at all the books on your shelves. Look at all the people who wrote all of those books. Well, many of our most esteemed authority figures in lactation were flown to beautiful Switzerland for a 3-day conference in which they were going to talk about and share all the everythings about lactation. A classic example that not only violates the international code, but is a business 101 model of how companies seek to influence the thought leaders in the field. So all of these hotshots got together and were chit-chatting with one another on the Nestle dime about lactation. And Nestle is like the Cruella de Vil. It's the biggest, baddest, worstest bad guy in marketing. It was Nestle's practices that prompted the hue and cry to pass the International Code of Marketing of Breast Milk Substitutes. All right, here's a pump manufacturer that is also a code violator because they market bottles and teats in a way that does not support the code. But look, oh, look, they're going to have a big deal symposium, right? And then, oh, look, here's another entity. It is the foundation that is funded exclusively by a pump manufacturer's money, but they're behind a firewall made out of tissue paper, is the way I put it. And look at their projects. What they're going to do is they've suddenly decided a 5-year-old foundation is in charge of everything having to do with lactation. We're going to create the textbooks. We're going to create the policy. We're going to do the teaching. I'm kind of wondering what the World Health Organization has been doing for the last, mega lumps of decades, right? Oh, really? We weren't doing any of that in the public health arena. We needed this foundation to come along, brand itself, and make sure that it brandedly was sharing branded information about the branding of branding. All right. Oh, here's our infant formula manufacturers. They are thick as thieves with the American Academy of Pediatrics, much to the chagrin of the section on breastfeeding of AAP. But you can go online. Oh, look, you can get all this free teaching. Get your teaching here. Get your teaching now if you're a doctor. Here's an example of a pump company. Now, a lot of times people, when they're, agonizing about the international code, will agonize and say, well, pumps are not covered under the code. That's absolutely correct. And there are some pump companies that don't have to worry about the code because they are not a code covered product. Absolutely correct. What else are they? They're still a commercial interest. They still have a fiduciary obligation to sell stuff, and they're still going to take advantage of using the marketing and persuasion techniques that we know are so successful for everything that is sold to us, from cars to formula to pumps. So this was a solicitation that went out to heavily on social media and also in emails to IBCLCs. And what I want you to do is remember the Cialdini book and the 6 things that are used to create influence and persuasion at an unconscious level. One of them is to consistently and repetitively use the brand name so that there's recognition with repetition, and that creates loyalty at a subconscious level. So how many times is the brand name mentioned in this one missive of 1, 2, 3, 4, 5, 6, 7, maybe 8 or 9 paragraphs? A whole bunch of megalup times, it's like 17. What about esteemed professionals? Remember, we're going to do things if we think that other people who we respect and who we like are doing it. Well, I should think IBCLCs would want to know what other IBCLCs are doing. So look at how many times that juicy phrase is thrown around in this same document. Oh, look, gifts and freebies. We know that reciprocity is one of the most powerful forms of influence and persuasion. Oh, look at here. We're talking about gifties a whole bunch of times. Social proof. Are other people doing it? Oh, yeah. Don't you worry. You come on along because everybody's doing it. And what about liking? Here's some elements of liking, right? So my point is that there is a lot of this going on. Here's what else I want you to know. It's still going on. This is from earlier this week, right? This was going around. A local professional association for IBCLCs, someone shared this and said, oh, hey guys, there's going to be a free breastfeeding webinar coming up. Well, yeah, coming from an infant formula manufacturer. It absolutely positively violates the code to do this. It absolutely positively will not get you CERPs, because IBLCE, the certifying organization for lactation consultants, will not approve education points for any commercial entity, right? So there's lots of examples where these things are happening and where they shouldn't be. So you're sitting there going, oh God, this is so like, oh, she keeps railing about things I can't do. All right, so let's cut it. Let's make it simple. Remember, we talked about healthcare providers. Who do they have a duty of care to? The patient or the client. Companies, who do they have a duty to? The owners, the shareholders, right? And if these two worlds are 100% separated, we have absolutely no problems, right? When I'm over here being a lactation consultant, it doesn't matter that there's a company over here making computers. What we need to ask ourselves when we're doing our care, whether it's as a volunteer, as a peer, as a licensed or a certified healthcare provider, is what kinds of medications or what kinds of products am I discussing with a patient or a client? And if I'm discussing anything, then those companies that make those things are the companies I need to be super duper wary of. I do not want to take freebies from those companies because they will be subtly influencing me and I won't even realize it. So that's why throughout all of the medical world, it's a big no-no to take free pharmaceutical samples, which is kind of laughable. Last time I went to a doctor, gave me a sample of something. They got it from the rep. It's not supposed to be happening. All of the ethics literature tells us this. All of the ethics commandments from all of the healthcare professions tell us that it shouldn't happen, and it happens all day, every day. Okay. Well, here's a product we talk about a lot in lactation. But because we talk about it a lot in lactation, whether or not they respect the code or not, we are not going to take any freebies or samples or gifts or lunches or pens or bags or education from these people. No, we're not, right? All of the products covered by the code. No, we're not going to take freebies or samples of all of this stuff. However, if Rolls-Royce comes along to you and says, hey, I like the work you're doing in lactation support. You want a free car? You know what? You go on ahead. You just take that free car, because I'm willing to bet you are not sitting down with any family and saying to them, oh, yeah, you had twins that came a little bit early. We really got to build your supply. And the way you're going to do that is to go buy yourself a Rolls Royce and drive around in it. Chocolate, right? There's some that say chocolate promotes lactation, but I don't think there's enough evidence. If a chocolate manufacturer comes along to you and says, you know what? I really like the work you're doing. I want to make sure that all of the people that come to your conference are, get a good treat. Here's a treat. Take the chocolate. I will caution you, don't take Nestle chocolate, but take the chocolate. Hershey's, right here in Pennsylvania, they're absolutely a company that you could patronize and get them to send you free samples. Jewelry manufacturers, anybody want to drape you in diamonds and pearls? You just go on ahead and take them, because I don't think any of us are telling new parents that they need to drape themselves in diamonds and pearls in order to be lactating. All right. So now let's segue to something that's a little bit more profound. And let's talk about racism. Let's find the place I'm supposed to be here. All right. So this talk was about the interplay of all of these things that I've been talking about. And those of us who've been in this field of lactation support know that if you look at demographics, there are differences and there's health disparities, and they've traditionally been described as race-based health disparities. But here's what we know. It's not race-based, it's racism-based, right? It's not a race that says the melatonin isn't a risk factor for any disease. What's a risk factor is being in a marginalized and traumatized population for 400 plus years, right? So one of my favorite researchers, talks about, when we see studies that talk about controlling for race, what we're really controlling for is exposure to racism. And of course, this is what, Kamara Jones has been talking about for decades. This was one of her earliest pieces on it in 2001. In her, beautiful language for it, tells us, Kamara Jones, Dr. Jones, although ethnicity reflects cultural heritage, race measures a societally imposed identity and consequent exposure to the societal constraints associated with that particular identity. That is, the race that an investigator notes or a study subject has learned to self-report is an excellent measure of exposure to racism. I love anything that Dorothy Roberts has written. I just sat on a 2-hour webinar last night that involved her exquisite, authorship and thinking on social change. And, we all of us, we will remember 10 years ago, we were all going to mandated cultural competency training at hospitals, which is kind of a laughable that we even use that language. But at the time, we just thought we were being so oh, we are just so on top of things. She says, no. She says, stop it. It's not about us learning and having to learn the cultures of other people. What we all need to be learning in medical school, because this was about medical knowledge, is how structures and institutions, and by that I mean our governments, our hospitals, our railway systems, our housing system, our water systems, how all of these structures are combining to become a source of trauma and a negative impact on various populations. That what we need to be learning in these fields isn't cultural competency. We should be becoming aware of how whole structures are making whole groups of people unhealthier than other groups of people. Many of you might know her from this very quite famous book she wrote, I think 25 plus years ago. She tells us that health-related factors previously attributed to culture or ethnicity are the downstream consequences of structural racism. Right. So, we have weaponized the poor for being poor. Oh, well, you've got this condition because you're poor. Well, how did I get poor? I didn't get myself poor. I come from a society that has made my ability to assimilate and take advantage so different from someone who looks like the speaker right now, that the downstream consequences are that I am unhealthier. I have more weathering. I have more trauma in my history, in my mother's history, in my grandmother's history, in my great-grandmother's history. This is a lovely article that I like, that just kind of rolls it all together in a very easy to digest way. So if you want to just kind of take all this stuff and kind of go, whoa, 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 this will be a nice resource for you. She talks about the long-standing effects of racism, which touch all African Americans, regardless of socioeconomic status, right? And there's several of our public health and professional associations have recognized this. And we are starting to see pop up, thank goodness, beautiful courses that are meant to provide care and to provide training in community, by community, for community. So the Black course, it says right out, trauma that is not healed is transferred. This is about Black folks learning from each other about how to provide care to each other in this environment, right? The Indigenous Breastfeeding Counselor Program, it's been nationally recognized for its excellence, and it is designed to be by and for Indigenous folks only. The only people let into the classrooms are Indigenous folks, and they are teaching it and they are learning it. Health Connect One has a many decades long history of doula training, support and care for the Latinx or Latina community. And they provide, again, culturally congruent, culturally matched care. And there's a fairly recent manifestation of groups, again, recognize the need. Like, this need isn't new, but the manifestation of advocacy groups for it is newer. And I think just this year, maybe this was the second year, the Asian American, Native Hawaiian, and Pacific Islander advocacy group created a breastfeeding week of their own. So we know that hold on, I got to pop to him one more. And I know I'm coming up. I got another minute or so, but this is going to be, there we go. This is how I want to bring it all together. All right, let's bring all of this stuff together that I've been talking about. All right, remember, we got our classic picture. We got the healthcare provider, we got the corporate interests, we got the separation works. So here's what I want us to think about. We know that the docs, healthcare providers, volunteers, with peer counselors are supposed to be providing information about good health. And we know that commercial manufacturers are supposed to be protecting their ability to make profits, right? We know that when these things start to overlap in a Venn diagram, we have this section in the middle. I'm telling you that that section in the middle is where we see a conflict of interest. Even though our friends on the right are going to tell us like, oh, look, we have so much in common. Here's our opportunity to collaborate, right? So now let's think about what happens when we add in the concepts of promoting anti-racism work and advocacy when we're providing healthcare and when we're providing lactation support to families. Again, when you got a Venn diagram, it's just looking at the overlap in those three little, where that little triangle-y thing that's in the middle is where the overlap is. Here's what I want us to think about. What happens if we take away our concentration on that middle triangle-y thing? What happens if we start to move those three circles and we instead start to merge them so they all come together in one place? I think that what we need to be thinking about is that we can be aware of and respect the International Code at the same time that we're respecting our need to engage in anti-racism work, at the same time that we can be respecting our commandments to avoid conflicts of interest. This should be our goal as providers of help. And there are entities out there that will help us to do it. Voices for Birth Justice talks about how formula campaigns, formula falls under the code, are aimed at Black mothers, aimed at a marginalized group. Kimberly Seals Allers wrote a book about it. And Kimberly is also the one who gives us these wonderful mottos. The answer lies in the community. You think there's a problem that needs fixing? You better go in the community and ask them. She strongly believes in culturally matched care by us, for us. And she reminds us that parents don't breastfeed, cultures do. And by that, she means that people who are engaged in lactation need the support of everybody, of their family members, their communities, their employers, their religious places, their recreational places. We know the commercial manufacturers take advantage of every element to come up with new hooks for marketing. And when COVID first came out, the formula manufacturers are all over it. Oh no, you better separate those mothers and babies and give them formula instead. And I do want to draw your attention to the beautiful page that Kansas Breastfeeding Coalition has. And there it shows you the rates. So like ka-ching, Kansas is like the rest of the states, the rest of the country. Higher rates of breastfeeding initiation by Asian non-Hispanics and white non-Hispanics, lower rates of initiation by Black non-Hispanics and Native or Indigenous non-Hispanics. But then when you scroll down on that page and you keep on scrolling, all of those things in red, those are all links to advocacy resources toolkits. Last, I'm just going to pull us out of here and say thank you and goodbye, if I can find it, by going to this last thing, because I think it tells us this. Right, here's a beautiful toolkit from Black Mamas Matter. But the reason I wanted to pull to this screen is because I just really like this notion that the idea of lactation care and respecting the code is because what we're trying to do is move our conversations and training to a rights-based health policy agenda. It's not about a choice of what to eat. It's about the rights of babies and parents to have excellent health. And with that, I'm going to see if I can't unshare my screen, say thank you, and see if there's time for any questions.
Brenda, is there time for questions?
Oh my goodness. I wish how about if we take, I wish there was, but hey, we're just going to listen to music for 10 minutes. So let's take a question instead of moving to a break, because I know, Liz, I just feel like this is something I need to sit with and really.
It all makes sense.
Wow.
And look, as I said before, my email, look, if the companies can find my email, you can too, but I will put it in, I'll put it in the chat and you'll transfer it over to Hoover for me. But if anybody wants to send me an email, I will answer your questions. And Miss Susan was saying I need to sing the international code song. Wait, I got to write hot Yahoo properly, which I'd be more than happy to send you into into your break singing it if you want me to, but I won't unless you say I should.
I would love that. I know Susan would love that. And Sapphire, I just want to check with you because you've been monitoring the Hoover chat. Do we have a question over in the chat? Last I checked, I didn't see one.
We do not have any questions. This was such an informative presentation.
Yeah, I think everybody was going, oh, she said that tweet was all I need to know. All right, so here you go. I'm going to sing to you the international code set to the tune of supercalifragilisticexpialidocious, and you could just block me off if you want. Teats and bottles formula and weaning foods for babies. No ads to families, docs or nurses, or where mothers birth. No samples or supplies in healthcare systems that have worth. No free or low cost formula in hospitals, please, sir. Hold dear the code of marketing for breast milk substitutes for teats and bottles formula and weaning foods for babies. Diddle-I. No gifts, no pens, no mugs, no meals, and keep the rep from mom. They shouldn't even offer these, nor pictures that earn awe. No cutesy logoed brands allowed, just scientific facts. Hold dear the code of marketing of breast milk substitutes for teats and bottles formula and weaning foods for babies. Diddle-I. Teaching about formula should be done 1-to-1. All labels must tout breastfeeding because formula's no fun. No pushing foods too soon on babes, and quality's a must. If you can't store and mix it up at home, then it's a bust. Hold dear the code of marketing of breast milk substitutes for teats and bottles formula and weaning foods for babies. Boom.
Wow. Wow. I will just say honestly.
So almost as good. Oh my God, you've got a new costume on too. I love this.
Is impressive. I was thinking that I would, show up I want to be like Beyonce and have.
Oh my God. Oh, now you're an ice cream cone. Oh my Lord.
Every time I appear, but your song, Liz, along with your presentation,
so embarrassing.
Outstanding.
Oh, you guys are great.
There are things to remember, and now everybody can take a break. We'll come back at 9:50, and
you guys are good sports. Thank you.
Thank you. Come back at 9:50, everybody.